brief update as to what's happening with regard to health care here on Capitol Hill. I know the situation is confusing, and I just wanted to plug people in to the fast-moving situation right here. Now, the bad news is that yesterday, as most of you know, the Republicans were able to proceed to a debate on their efforts to repeal the Affordable Care Act. That means they passed a motion by a 51-50 vote. The vice president had to cast the tie-breaking vote in order to go forward to begin this debate. That is something I had hoped very much would not have happened. I would have hoped we could have defeated that effort to go forward and end this absurdity right now. But we were only able to get two Republicans to vote no on that proposal. That was Senator Collins of Maine and Senator Murkowski of Alaska. So with the vice president breaking the tie, they were able to go forward. That is the bad news. Let me give you the good news. And the good news is that last night we defeated, rather soundly, what was essentially the Republican plan to repeal and replace the Affordable Care Act. You remember Mr. McConnell and others talking about they were going to repeal it and they were going to replace it, and they were working on this day after day after day. Well, we ended up defeating that proposal by a vote of 57 to 43. That's a pretty large margin, with 9 Republican senators joining every member of the Democratic caucus in opposition. That's a big deal, because that was their main effort to repeal and go forward, trying to destroy the Affordable Care Act. As many of you know, that amendment would have thrown 22 million Americans off of the health insurance they currently have. It would have cut Medicaid by almost $800 billion, taking health care away from millions of low-income and working-class families, including many children with special needs. That legislation would have dramatically impacted nursing home care. If you got a mom or a dad who's in a nursing home, understand that Medicaid pays about 2/3 of the cost of nursing home care in this country. So it would have had a dramatic impact on many people with disabilities and elderly folks who are in nursing homes. That legislation, which we were able to defeat, would have substantially decreased funding for us to go forward and try to address the heroin and opioid crisis, which is sweeping my state of Vermont and sweeping this entire country. Medicaid provides a very substantial part of the funding for opioid and heroin treatment, and that would have been significantly cut. Furthermore, despite Mr. Trump's rhetoric about being a champion of the working class, that legislation would have substantially raised premiums for older workers. In many parts of this country, premiums actually would have doubled for older workers, which is why AARP and virtually every major senior organization in this country strongly opposed that bill. Furthermore, at a time when 2.5 million women have chosen Planned Parenthood as the place where they want to get the health care that they need, the quality care that they're getting, that legislation would have defunded Planned Parenthood. Further, that legislation would have made it extremely difficult for people, millions of people, who have pre-existing conditions to get the affordable health care that they desperately need. Now, that was the vote yesterday. So the good news is we defeated the Trump-McConnell repeal and replace health care bill. That was good. That was yesterday. Now, today, literally just a few minutes ago, the Senate defeated an amendment by Senator Rand Paul, which was even more extreme than the Trump-McConnell repeal and replace bill. And that bill by Senator Paul would have essentially completely repealed the Affordable Care Act without even trying to replace any part of it. And that legislation would not have thrown 22 million people off of the health care they have. That was too modest an effort from Mr. Paul's perspective. It would have thrown 32 million people off of the health insurance they currently have. So that's where we are. And that legislation, I'm happy to tell you, was also fairly soundly defeated. So, bad news is we are proceeding with a disastrous process which will wreak havoc with millions of families in this country. Good news is that so far we have defeated their two major initiatives. Now, what's going to happen next? The answer is nobody knows. We're in a little bit of a chaotic situation here. But what we expect, among many other things, is that the Republicans will bring forth what is called a skinny repeal. In other words, it won't repeal all of the Affordable Care Act. It will be more limited in what it does. But what it would do is repeal the individual mandate, which is very, very significant. It would repeal the employer mandate. And when you do that, you're going to throw about 15 million people off of the health insurance they currently have. I suspect that within that bill, they will also try to defund Planned Parenthood. So that bill will also be a disaster. We're not quite sure when that is coming up, but it is imperative that all of us from coast to coast stand together, fight back, and make sure that that does not happen. The goal of the Republicans is to pass something at least, then go to conference with the House bill and try to carve out and develop some legislation that can get past the Senate and that can get past the House. There's also actually some thought that if they got through with this skinny repeal legislation, that the House might adopt that. But we don't know that. Now, what all of you should be aware of is not only are these bills absolutely horrific in terms of what it will do to working class people, lower income people, middle class families all over this country, the process by which this whole healthcare debate has gone forward is unprecedented and is a real disgrace. Here you have legislation which will impact every single American, because that's what healthcare is about. It will impact 1/6 of the American economy. And all of this legislation, all of these bills have been written behind closed doors with a handful of Republicans. There has not been one public hearing on this legislation. We've not heard from one doctor, one hospital administration, one senior advocate, one patient advocate as to what this legislation will do to the people of the United States. So this is absolutely unprecedented and a real disgrace. Furthermore, this legislation is opposed. All of these bills are opposed by every major healthcare organization in the country: the American Medical Association, doctors; the American Hospital Association, all of the hospitals in America; the AARP, representing senior citizens; the American Cancer Society; all of the doctors' organizations, patient organization, understand the horror that this legislation will bring about, and they are opposed to it. And furthermore, not only are all of the organizations, the national healthcare organizations, opposed to it, the American people are opposed to it. The last poll that I saw was done by USA Today. It had 12% of the American people supporting this legislation. So everybody knows that this is a disaster and it must not go forward. But the Republicans, I think, are more interested in appeasing their very wealthy billionaire campaign contributors rather than addressing the needs of the American people. So we are where we are right now. So bottom line here is we are in the middle of a titanic struggle. I mean, this is big stuff. This is going to impact almost every family in America. All over this country, people have stood up. They have fought back. They've gone to town halls. They've gone to rallies. They've used their social media. They've contacted their members of Congress. Please keep the pressure up. Please do everything that you can to help us defeat this horrific legislation. Our job as a people is not to throw 32 million people off of health insurance, not to throw 22 million people off, not to throw 15 million people off. Our job as a nation is to join every other major country on earth in guaranteeing health care to all people as a right through a Medicare for All single-payer program. And that's the fight we're going to wage. But right now, what we have got to do is make sure that people are not placed in an impossible position through the passage of any of these kinds of legislation. So thank you very much for what you're doing.